I want to say here that I think that events like this one are really a great way to get together people of all different depths of knowledge and background to get some insight into what it really means to take somebody through transplant and then manage post-transplant complications, and really efforts that are put into it. And a lot has been done in the last 5 to 10 years, and I think this is really an exciting time to be working in this field. And we know now that number of transplants that are being performed, and also the number of transplant survivors is increasing, and a lot more people now who are above age of 70 are being transplanted. So when we think about post-transplant complications, there are some complications, and these are primarily risk of relapse and GvHD, that are more prevalent in the first couple of years after transplant. And then as people survive that and the time goes forward, there are other risks that come to play, and these are risks of living with some complications of transplant that really are an interplay of things that happen through peri-transplant and early post-transplant period, but also maybe some risk factors that are predating transplant. So it's important to say that people who have undergone transplant really will need lifelong care and follow-up and care coordination. So that is something that we call survivorship, which will include usually different subspecialties, the transplant physician, but then also endocrinologist and bone specialists and cardiologists. Some of these people can have cardiac complications. And as I said, many of transplant survivors are older being transplanted, but also with our advances in managing of GvHD and supportive care, many people now live to be longer and older after transplant and will need good, well-coordinated survivorship programs. And that is also something that a lot of effort have been put in standardizing and really developing that field. And important thing is that many of these post-transplant complications could be treatable, could be potentially preventable, and that's why it's important to think about that in advance.